So, welcome to the Geriatric Emergency Department monthly newsletter. My name is Mike Malone, and this is June 2018. Today, we're going to talk about providing non pharmacologic approaches to the care for older patients who have delirium and present to the emergency department. So, the background information is that the management of older adults who have delirium in the emergency department is primarily non-pharmacologic because there's no FDA-approved medications for this particular treatment. So the key approach is to understand and evaluate the factors that may predispose the patient to delirium, as well to understand and evaluate those that might have precipitated the delirium. So we'll point out 10 points to you in managing the patients who have delirium in the emergency department, primarily focusing in on the non-pharmacologic treatments. Number one, determine the patient's baseline cognition and their behaviors as well as their function. You may need to check with family members, caregivers, or the facility at which the person lives in order to determine this information. What you want to do is to determine when the behaviors or the changes in the behavior began and really kind of describe exactly what happened and what the time course is. Number two, evaluate for common contributing factors for delirium, namely medications, infection, electrolyte disturbances, malnutrition, sleep disturbances, constipation, urinary retention, pain, traumatic injury, and then finally intracranial events like stroke or subdural hematoma. So in short, you want to figure out the underlying causes, and usually there's several, that might have contributed to the delirium. Number three, carefully review the medications, both the prescribed and the over-the-counter medications, noting any recent changes in those medications, as well noting centrally acting medications. Consider withdrawal as a factor that might be contributing to the patient's delirium, namely stopping SSRI medications or stopping abruptly benzodiazepine medications. Number four, systematically consider the patient's unmet needs, such as pain, as we talked about before, elimination, thirst, hunger, sleep, or trouble communicating. These may as well contribute to the patient's delirium. Number five, consider if the patient needs any additional support for their hearing or their vision, such as a voice amplifier or their patient's hearing aids or their eyeglasses. Again, this can be a basic but important area of non-pharmacologic approach. Number six, consider the environment in which the patient is receiving care. Is the emergency department too stimulating with lots of noises, commotion, and a generally anxious setting with unfamiliar faces? Could that be more comforting with a calmer approach, perhaps something that's engaging and meaningful to the patient, and perhaps a familiar family caregiver? Number seven, communicate clearly, be straight up and straightforward with the patient. Make sure that the tasks are kept simple and that you're comforting in your approach to the patient. Number eight, encourage the mobility even among these patients who may be vulnerable. Physical therapists can help in the emergency department. They can give you an assessment of the patient's gait and balance, or as some of the docs call this, a road test. Definitely try to avoid physical restraints. Number nine, reassess the patient regularly. Some of our patients stay in the emergency department a period of hours or more. So a serial assessment by the emergency department provider can give you a better feel for the patient's cognition over time. Sometimes a patient may develop delirium during their course of stay, You'll need to kind of watch the patient, monitor, and hover to make sure that you've got a good, clear assessment of those patients. Number 10, and finally, really consider the caregiver's needs, their presence and comfort. So the family caregiver plays an important role in comforting and reassuring the patient in the environment of the emergency department. Make sure that the family caregiver is comfortable, has a place to sit, and is engaged in overall the plan of care for this individual. So overall, we've had a chance to look at non-pharmacologic steps in the care for older persons in the emergency department who have delirium. This is an important part of our excellence in the care of older adults. Thanks for joining us. Have a great day.